So, in its simplest form, autism is a neurodevelopmental condition, as we call it, which means it's present from birth and persists through life. Um, it can be moderated, it can be attenuated, but doesn't go away. It is part of who one is. And by its very nature, it's called a pervasive difficulty, which means it affects all areas of one's functioning, whether it's emotional, social, academic, or even life, really, life implementation aspects. But if we were to break it down to very simple domain areas, we are looking at key difficulties in the areas of reciprocal social interaction, communication, and stereotypies or repetitive behaviors, which could potentially present as what we call cognitive rigidity, which is a certain set way of thinking or being very particular about things. Sensory difficulties are a very important aspect of autism. ADHD, attention deficit hyperactivity disorder, to a degree self explanatory in that, of course, we are looking at difficulties with attention, difficulties with hyperactivity or restlessness or fidgeting, as the case might be. But it doesn't just stop there. Again, at the very core, it is a neurodevelopmental condition, which means it's present throughout life. Though our knowledge and understanding and research has shown that with right support and guidance, there can be a significant positive improvement in the symptomatology and the quality. The main domains ADHD can affect, as I said, hyperactivity, inattention, um, impulsivity is a key factor, so that could translate into risk taking, say for adolescents. Um, Difficulties with executive functioning, as we call it, which affects a very key aspect, key part of the brain, and translates into problems with day to day kind of sequencing or organization. It might be forgetfulness. It can show up in lots of ways, but basically they have an impact. When you're a student, of course, it impacts academics, one's ability to plan, organize, complete tasks, and all of that. Um, and again, from if one's highly active, and that again might be what we call motor hyperactivity, which means kind of really fidgety and moving around, or the hyperactivity might all be happening here. We tend to see that a bit more in girls. So on the surface of it, it looks like everything's okay. But for some reason, that young person's potential is not really matching up to their outputs. So there's a clear discrepancy there. So we have to try and understand why that's happening. The difficulty is, of course, that each of these conditions present very uniquely in every child or young person or adult. It's a very complex, kind of layered set of difficulties. But if we are to kind of look at broad similarities, they're both neurodevelopmental conditions, i.e., they're present throughout life, present since birth, and they carry on. They both have a significant impact on various domains day to day, whether it's social interactions, social communication, social relationships, academic attainment, academic task completion, all of those things. But the quality of that is quite different when you look at ADHD as opposed to autism. Again, there is a lot of overlap between them in any particular situation, which doesn't help. It complicates the matter, which is why it makes it really important to have an early clarity and diagnostic understanding as to why certain things are happening the way they are in any particular scenario. So I'll give you an example. Um, in in autism has always been known for children who or young people who might hyper focus. They're so intensely into the things that they are very interested in. And now more and more, we are also hearing about hyperfocus and ADHD. Yes, on the face of it, they both hyperfocus, but the quality of that and the impact of that is very different, as you can see academically. On the other hand, you also have ADHD with very limited focus. So there is that complex interplay there as well within ADHD. In its simplest form, I think it'd be fair to say that both have a significant impact on all areas of functioning, but at the same time, they are considerably different in their nature, the quality, and the impact they have on one's day to day life and that of their family. Unfortunately, neurodevelopmental conditions do carry certain vulnerabilities and associations that are more than in the general population. We do see an increased incidence of depression and anxiety in both ADHD and autism. There are some that are more that have a stronger association, like for example, with autism, sensory processing difficulties are more. There might be more questions around obsessionality versus obsessive compulsive disorder, those kind of things. Whereas with ADHD, there is more of an association with, unfortunately, substance misuse or addictions. Also, oppositional defiance and conduct, though they could be. Oppositional defiance could be a key component of both. When we look at the significant impact these two conditions have on one's life and functioning, it's not surprising that they start to lose faith in themselves, their confidence goes, um, it erodes, would be a good way to put it. And more they find themselves getting increasingly isolated from the activities they like and the people they enjoy being with. And these are, unfortunately, this is a recipe for anxiety or depression, as the case may be. There is an increased association of ADHD and autism co occurring. It is possible to make very clear diagnoses of both in many young people. But at the same time, it is quite possible that one's predominant or has taken over and the other is not very clearly apparent. For example, if you have someone with very hyperactive ADHD, they might have autism as well, but the ADHD starts doing a lot of the talking because they're just here, there, and everywhere. And it becomes really difficult to understand who the person is underneath. So it does require, again, a stepped approach. It's like peeling the layers of an onion sometimes. Both ADHD and autism carry social difficulties. It's a bit more from the in autism from the perspective of social communication. Um, in autism, there is a difficulty with kind of potentially initiating social interactions, communicating effectively or communicating in a timely way. Whereas in ADHD, it's more let me jump in before I think kind of a response, which translates to blurting things out or interrupting conversations, which can leave an adverse impact socially and obviously affect friendships and relationships. Sensory difficulties again tend to be a lot more observable or predominant in autism or autism spectrum conditions. Um, and they can they tend to show up in various ways, really. It could be think of the five senses. It could be any of those. It could be a visual overload. It could be difficulties with noises of any kind, difficulties with touch, taste, the feel of things, textures, the whole gamut of it. In ADHD, it's not really a very kind of key aspect of what constitutes ADHD. Given this substantial overlap, sometimes we might have behaviors that align with sensory seeking, but again, the quality and the nature of those are very different to autism. I think it'd be fair to say that behavioral difficulties in some shape or form is seen in many children with autism and ADHD. Again, the quality is very different. We tend to see more overt behavioral difficulties from the perspective of impulsivity, thrill seeking, in ADHD, whereas in autism, it might all be around not get a certain desirable outcome not happening because they have their mind set on something, it doesn't happen. It might be difficulties with transition or change. So the quality of what triggers these behavioral difficulties are very different. It's very important when we're thinking of children, young people, to consider timely diagnosis, early intervention is absolutely vital. It can make all the difference in the way they approach relationships, their education, their engagement with education, their engagement with people and life itself. So, absolutely, yeah, diagnostic clarity is key.